My name is Brenda Ramirez. I'm a family and nurse practitioner student, and I'm here to take care of you. Can you tell me why you're in here?
I'm here for a cardiovascular exam.
Okay, before I begin, can you tell me your full name and date of birth?
Felipe Ramirez, 1 May 1989.
Okay. I'm going to be recording this assessment, so may I have consent?
Yes.
All right. So in order to get my cardiovascular assessment started, what I'm going to do is I'm going to assess his blood pressure on his upper extremities bilaterally while he's sitting upright, and then when he's laying down, I would assess his blood pressure bilaterally on his upper extremities, left and right. I'm going to start off by assessing for jugular venous distension, which I don't see any. I'm starting with the neck. I don't see any jugular venous distension. I'm going to assess his jugular venous pressure, and in order to do that, I have to have him sit down at a 30-degree angle. So can you please lay down, Mr. Ramirez? And I'm looking for his jugular venous, the internal jugular venous pulsation. And sometimes to differentiate the carotid pulse from the jugular venous pulsation is just by palpating it, and then if it continues to pulsate, that's usually the carotid. And I could see it right near the sternal border, sternal angle. So what I'm going to do, I'm going to measure this. If it's greater than 3 centimeters, it would give me a sign of congestive heart failure. So what I'm going to do is I'm going to go to the highest peak. And sometimes if you can't, you still can't see it at 30 degrees, you can lower the bed. Or if it's too high, then you can kind of increase the bed, depending on where you see it. So I kind of see it. I see it right here. It's the highest peak. And I'm going to measure from the sternal angle. And it looks like it's a 1.5 centimeters. That's actually really good. Anything less than 3 centimeters is considered normal. After that, now that I'm done inspecting, I'm going to palpate for the carotid artery, and I'm going to do this on both sides. And as I'm palpating, I'm also timing. You can do 15 seconds and then multiply by 4. I can see regular rhythm, rate, 64. And the amplitude's about a 2. So now I'm going to make sure that it's symmetrical on the other side. Turn his head. You can have them turn their head for a better assessment. You don't want to do the carotid notch. You don't want to go up here because you can drop the pressure. So as I'm palpating, I'm also looking to make sure that there's no thrill on either side, and none was noted. Regular rhythm, amplitude is about a 2, and it's symmetrical, about 64 rate. That's for the carotid artery. And now I'm going to auscultate the carotid artery. And in the carotid artery, there's 3 sides to the carotid. What you want to do is it's going to be the angle of the jaw, which is 1, and then the mid-cervical, and then the base of the neck. I'm just going down. And I'm going to be auscultating with my diaphragm and my bell. And I'm just going to be listening for any bruits or murmurs. I'm going to start with my diaphragm. go. I don't hear any bruits or murmurs. I don't hear any bruits or murmurs. And I'm going to be listening to it bilaterally on the right side and the left. I'm going to go to the other side. I'm going to have them turn. I didn't feel any bruits or murmurs. As soon as I'm done auscultating, I'm gonna inspect his trunk area. I'm assessing for any symmetry. I'm also looking at that apical pulse, or also the point of maximum impulse, or you would also known as that, or mitral area. I'm looking, and I can actually see a bounding, even though I can actually feel a pulsation. Even though he has muscle, I can still see that pulsation. But I don't see any other precordial pulsations, abnormalities. I don't see any indentations. Um, uh, Chest rises symmetrical. Um, uh, the sternum, it doesn't show any deviations. There's no color discoloration. I'm looking for any thrills, leaves or lifts, and I don't see any besides that apical pulse, which I can see, and it looks like it's about the fifth, well, before palpating, I would be just looking, but it kind of looks like it's the fifth, um, intercostal space, mid-clavicular line. Maybe you could see that pulsation. And that's upon inspection. I don't see any other chest wall abnormalities, and or precordial pulsations. For the abdominal aorta, I also don't see any pulsations. If I were to be able to see any pulsations, it would give me a sign of like abdominal aorta aneurysm. It would give me a sign for aneurysm, but I don't see the pulsations either. Next, I'm going to start with palpation. I'm going to palpitate. I'm going to start at the aortic area, so which is the second intercostal space, right sternal border, and I'm going to feel. I'm feeling for any leaves, lifts, which is just kind of like tapping. The leaves would be a little bit stronger than the lifts. Or heaves. Heaves would be more like purring, and that you could feel right with the palm of your hand. You could feel both of those. And I don't feel that. Now I'm going to go to the pulmonic area, left sternal border, second intercostal space, so you just locate that. And I don't feel any leaves, thrills, or lifts. Now I'm at the second, I'm going to the third, which is Erb's point. I'm at the left medial sternal border, third intercostal space, which is Erb's point. That's where you could hear normally the S2 split. Next, we're going to go down to the tricuspid area. So I'm on the third, I'm going down to the fourth intercostal space, left sternal border. I don't feel any leaves, lifts, or thrills. Now I'm going to go to the point of maximum impulse, also known as apex or mitral area. and I don't feel any thrills, leaves, or lifts. And now I'm gonna palpate also his abdominal aorta. And as like I said, I didn't see any, I don't feel any thrills, leaves, or lifts, but I should be able to palpate his, the pulse, aortic pulse. And it feels like the amplitude is about a +2. You just kind of have to apply pressure in that epigastric area. Feels about like a +2, 64 rate, regular. And now I'm gonna go down and feel his femoral arteries. Usually it would be bare, but for video. And you're gonna feel this bilateral. You're checking for symmetry. You wanna make sure that it's symmetrical. Regular rate, rhythm, and amplitude is the +2. So now that I'm done palpitating, I'm gonna start. I'm gonna start by auscultating. When I'm auscultating, I'm gonna be looking for any brutes, any murmurs, any S3, S4, any gallops, any friction rub. That's what I'm looking for. And the whole time I'm going to be just turning my diaphragm and my bell. And I'm going to start with the aortic area. And once again, the aortic area is, I'm going to locate second intercostal space, right sternal border. I only hear a S1 and a S2. I don't hear any S3, S4, extra sounds. Now I'm gonna go to the pulmonic area, which is the left intercostal space, left sternal border, second intercostal space. So I just move over and I'm listening. I don't hear any extra sounds. I only hear S1 and S2. Now I'm going to go to Erb's point, left medial sternal border, third pelvic, third intercostal space. And this right here, during inspiration, so as he inhales, I might be able to hear the S2 split, which is the semilunar valve closing, which means the aortic valve closes like 0.06 seconds before the pulmonic valve. And that's still normal, but during expiration, that's when you shouldn't hear that split anymore. It should go away. So that's where you're listening to in Erb's point. Now, I'm going to go down to the fourth, which is the tricuspid area, fourth intercostal space, right one below, and left sternal border. And you want to listen with the bell and the diaphragm. On both sides, the Erbs, let me just switch it over to the bell. I don't hear any extra sounds. I don't hear any S3, S4, no murmurs or brutes. Now going to the fourth intercostal space again, the tricuspid area. I'm listening for any brutes, murmurs, S3, S4 sounds, no friction rub. Just the S1 and S2. And if you don't know if it's a S1 or S2, what you can do is locate the carotid pulse. And then once you feel that thump on the carotid, the that carotid pulse, that's when you know it's a S1. And that really works out for me, just to figure out which one's S1 and S2. And I'm gonna turn the bell over. Again, this is the tricuspid area, fourth intercostal space, left sternal border. Now I'm gonna go to the point of maximum impulse, the mitral area, which I go one more clavicle down, mid clavicular line. Again, I'm doing this with the diaphragm and the bell. And I'm listening for any brutes, murmurs, S3 sounds, or S4, which I don't hear any. S1 seems to be more noticeable right here in the apex. Now that I'm done with the pericardial areas, I'm going to go down to my epigastric area for abdominal aorta. And I'm just going to listen with the diaphragm. And I'm listening to see if I hear any brutes or murmurs. Now with my bell. Now I'm going to go down to the femoral artery, and you're going to do this on both sides bilaterally. You're going to do a bare skin in the clinical area. I don't hear any brutes or murmurs. Again, now I'm going to the left side. No brutes or murmurs. Okay, so no brutes or murmurs were heard, no extra sounds were heard, just the normal S2 split, just regular S1, S2. That's auscultation. Now I'm going to assess the extremities. I'm feeling for warmthness, which I can see he has warmth in all extremities. Now I'm going to start with the pulses. I'm going to start with radial pulse. And the whole time I'm going to have my watch right here. I'm going to place it right here as I'm going. And I'm checking for symmetry, regular rate, rhythm, and the amplitude, about a +2. Bilaterally symmetrical. That's radial. I'm going to go to the brachial. And I'm assessing both sides. And you want to time it, you can do 15 seconds again, multiply it by 4. Regular rate, rhythm, rate, 64, regular, rhythm, amplitude, a 2 at the brachial pulses. I already felt the abdominal aorta, the femoral. Now we're going to go down to the popliteal. You just go right under. Again. You're feeling for symmetry, regular rate and rhythm, rate 64, amplitude's 2. I'm going to go down to the dorsalis pedis. So for video, you just go right at the top right here. And you're just comparing one to other, regular rate, rhythm. If you can't find one on one side, you just look at where your finger is at and then locate it. And then now you try and look for it on the other foot. And that's the best way to locate it. They're both amplitudes of 2, regular rate and rhythm, symmetrical on both sides. Now I'm gonna go to the posterior tibial pedis, which is right in here, the tibial. This is the tibial pulse, by the way. Posterior tibial pulse. And you want to compare it one to other, regular rate, rhythm. You can just do 15 seconds, multiply it by 4, unless you get an abnormal number, like over 100, less than 60, or you feel some abnormality, then you do a full 1 minute, or there's a specific problem in that area. Regular rate, rhythm, and a +2 on amplitude. Alright, now I'm going to assess the extremities and the skin. I'm just looking for any signs of cyanosis, any signs of edema. You can assess for pitting edema, which I don't see none. Make sure you assess right. There's no varicose veins. I don't see any. You're looking at everywhere. I don't see any shunts. Color is nice and pink. It's warm in all extremities and throughout the body. Next, I'm going to assess the hands. I'm looking for any cyanosis, any clubbing. I'm looking for any splitting hemorrhages and any tar staining. I'm also going to assess capillary refill, and you want to do this on the upper and lower extremities and each finger. Capillary refill is brisk, less than about a second, so less than 3 seconds is good. Now I'm going to also assess this on his lower extremities. And this one's pretty quick because capillary refill is less than a second. I assessed the whole skin, the body, everything seems symmetrical. Pulses are all within limits, +2s, and he does not seem like he's in any strain. So this about concludes our cardiovascular assessment.